Be seated. I want you to remember that no bastard ever cured disease by talking to it. He cured it by exterminating it. Students, all this stuff you've heard about doctors not wanting to use drugs, not wanting to cut, is a bunch of horse dung. Doctors traditionally love to prescribe. All real doctors love the glint of the blade. When you were pre-med, you all admired the rapid hysterectomy, the snap diagnosis, the charge of the CAT scan, the power of the pill. Doctors love a procedure and will not tolerate conversing. Doctors are on the attack all the time. I wouldn't give a hoot in hell for a doctor who sat and talked and got up and walked out. That's why doctors have never failed to be aggressive and never will fail to be aggressive, because the very thought of doing nothing is hateful to doctors. Now, the hospital's team lives, sleeps, eats, treats as a team. It acts. This talking treatment stuff is a bunch of crap. Those biggest bastards that wrote that stuff about psychotherapy for the New England Journal of Medicine don't know any more about real medicine than they do about fornicating. Now, we have the finest technology, drugs, equipment, best students in the world. By God, you know, I actually pity those poor bastard diseases. By God, I really do. We're not just going to poison disease. We're going to cut them out, freeze dry them on our pathology slides. We're going to yank out festering uteruses by the bushel. Now, some of you students I know are wondering whether or not you'll hesitate, waste time getting to know your patient. You ought to be treating them. Don't worry about it. I can assure you that you all will do your duty. Time is the enemy. Patients' bodies starve for benevolent intervention. Medicate, operate, radiate. When you place your hand on the frail shoulder of a shivering anorexic body, the shadow of a human being, you'll know what to do. Now, there's another thing I want you to remember. I don't want to get any messages saying we're holding for observation. We're not holding for anything. Let the chaplains do that. We're advancing constantly. We're not interested in holding anything except good teaching cases. We're going to grab the whiners, the crybabies, by the genitals and kick them in the ass. We're going to keep them out of our hospitals at all times and quit this pissing in the wind. Now, there's one thing you doctors will be able to say when you get back home, and you may thank God for it. 30 years from now, you're sitting by your fireside, your grandson on your knee, and He asked, what did you do in the great war against disease? You won't have to say, well, I did psychotherapy. All right, you sons of bitches. You know how I feel. I will be proud to lead you wonderful doctors into the arena of real medicine anytime, any place. That's all.